Hello, everyone. Thank you for joining. This month's webinar, the topic is Men's Health, Leading Causes of Death, and our presenter is Terry Somerville, and she's an RN and a health coach with Strategic Health Services. Terry?
Hi, thank you, Dawn, and thank you everyone for attending. As Dawn said, this month we're going to talk about men's health issues. And many of these health concerns can lead to devastating illness and death. As health coaches, we focus on several of these topics with the hope of providing support and education, preventing early progression of these illnesses. Now, the top 10 leading causes of death in men are heart disease, cancer, stroke, COPD or emphysema, chronic bronchitis, accidents such as traffic accidents, falls, pneumonia and flu, diabetes, suicide, kidney disease, chronic liver disease, and cirrhosis. Now, men do die at a higher rate than women for all 10 of the top 10 causes of death. They also die at a younger age. Women survive an average of 5 years longer than men, and one reason is felt that women are 33% more likely to seek medical help than men. But it should be noted that this gap in seeking health care does equal out as men age. While this slide shows the top 10 leading causes of death in men, I will go more into depth on those that you can actively work with your health coach to improve. Heart disease. Monitoring is important. It is felt that the lack of health care monitoring early in life is a direct result for the progression of this illness, heart disease being number one. Now, having your cholesterol checked when it's likely to start to increase at age 20, monitoring your blood pressure when you may also see an increase around the age of 30, and your blood sugar at age 40 when it may also start to increase. One can only speculate what would be happening at age 50 if none of these steps have been done. For men, heart disease begins to manifest or show its initial symptoms around 10 years before women. This means men have a shorter time period to prevent the development and decrease their risk. And according to the American Heart Association, the main risk factors for developing heart disease are increasing age, male gender, family history, smoking, high blood cholesterol, hypertension, physical activity, diabetes, and being overweight or obese. So what is a heart attack? A heart attack occurs when one of the main 4 arteries in your heart become blocked. This blockage occurs when the walls of the artery begin to build up with cholesterol or plaque, narrowing the artery itself. It may narrow it or even occlude it or close it completely so that even the smallest of clots cannot flow through to the heart. When this happens, the muscle in the heart that is fed by that artery begins to die, or a heart attack occurs. Now, for prevention, eating a healthy diet is an important thing. Early prevention to lowering your risk factors is key. Eat a healthy diet. A heart-healthy diet includes lots of fresh fruits and vegetables, whole grains, limiting saturated and trans fats, low-fat protein, limit your sodium, monitor your blood pressure, get your yearly lab work to monitor your blood cholesterol and blood sugar levels, and if you're diabetic, keep your blood sugar at a healthy range. Maintain an A1C under 7. If you smoke, stop, and above all, stay active. Now, cancer. All forms of cancer are the number 2 leading causes of death. Lung cancer ranks number 1, prostate cancer number 2, and colon cancer ranks number 3. Lung cancer, the good news about lung cancer is it has been shown to be on the decline since the 1980s. Prostate cancer, while number 2 cause of death, is actually most prevalent, and luckily, if caught early, is very treatable. Colon cancers are most often found in people at age 50 or older, and testing can save your life. This screen shows a healthy lung on the left and a lung with emphysema on the right. And I wanted you to see that just to see the difference in what an unhealthy lung looks like. So about 8 out of 10 cases of lung cancer deaths are thought to be from the result of smoking. Risk factors for developing lung cancer. Smoking is responsible for 90% of lung cancer. Exposure to secondhand smoke, exposure to asbestos or radon, a personal or family history, and air pollution are also risk factors. Prevention remains mainly with smoking cessation or quitting smoking. Lung cancer is one of the few cancers that can often be prevented. If you smoke, ask your primary care physician to help you quit. If you're a non-smoker, don't start, and avoid breathing in other people's smoke. If you are at high risk for lung cancer, talk to your primary care physician about the benefits of a low-dose CT scan for early lung cancer detection. Testing can benefit adults who are current or former smokers between the ages of 55 to 74, who are in good health and have a 30-pack year smoking history. Simply put, a 30-pack year smoker smoked on an average of a pack a day for 30 years or 2 packs a day for 15. You want to stay away from all forms of tobacco and above all discuss the benefits, limitations, and risk of lung cancer testing with your primary care physician. Early detection before it spreads gives you the best chance to do something about it. Now, prostate cancer is the most common cancer found in men. Little is known on what causes it or how to prevent it, but prostate cancer is very treatable if caught early. Risk factors. The American Cancer Association recognizes these as risk factors: increasing age, African American men, men with a high-fat diet, men who eat a lot of red meat and high-fat dairy products with not enough fruits and vegetables, men who have one or more close relatives with a history of prostate cancer also increase their risk for developing prostate cancer. Now, prevention. As I mentioned, little is known about prostate cancer and how to prevent it, but the American Cancer Society does recommend the following. A PSA, or prostate-specific antigen blood test, be offered annually for healthy men starting at the age of 50 or older. A digital rectal exam be offered annually for healthy men starting at age 50 or older. Those at high risk, such as those with a family history of prostate cancer or African American men, should begin testing earlier. You should know your family history, and if you are an African American male, or you have a father or brother who has had prostate cancer before the age of 65, you should talk with your primary care physician starting at about 45. And it is recommended that you have a PSA or prostate a specific antigen level with or without a rectal exam. How often your testing will depend on what your PSA level is at your initial one. Now, colon cancer. The third leading cause of death by cancer. About 72% of cancer cases occur in the colon, with 28% in the rectum. In 2015, it was estimated that 132,700 new cases were diagnosed, and that more than 49,700 people will die from this form of cancer. Most colon cancer develops in people ages 50 and older, people with a family history of colon cancer, people who have polyps in their colon or rectum, or those with inflammatory bowel disease are more likely to have colon cancer. So what is colon cancer? The colon is the large intestine, and the rectum is the last 6 inches of the intestine connecting the colon to the anus. About 72% of the cancer cases, as I said, occur in the colon and 28% in the rectum. Colorectal cancer usually develops slowly and begins usually in a small growth called a polyp. A polyp will grow larger and can eventually turn into cancer, and this process usually does take years. Once cancer develops, it grows into the wall of the colon and will eventually spread or metastasize. The risk factors are obesity, diabetes, smoking, eating a diet mostly of high-fat foods from animal sources, Being inactive increases a person's chances to have this. Drinking 2 or more alcoholic drinks per day. Now, colorectal cancer. In general, about 6% of men will develop colorectal cancer. Several factors will increase that risk. Men younger than 40 almost never develop colorectal cancer. Over 90% of the cases are in men over 50. A family history with anyone in your immediate family or near relative having had cancer at a young age, you should be screened earlier. Previous colorectal cancer places you at a higher risk to develop a new cancer. Inflammatory bowel disease, such as Crohn's or ulcerative colitis, for several years also increases your risk. Now, this picture also shows you the colon and the rectum, so it gives you an idea of what I've been talking about. Now, for prevention, a colonoscopy, or the insertion of a flexible tube into your rectum while under sedation. With this procedure, your gastroenterologist is able to see and remove any polyps or cancer before it spreads. If your colon is clean or without any polyps, you probably won't need another for 10 years. Now, there is also a flexible sigmoidoscopy, which looks only at the lower colon and rectum, and it's less popular. Now, stool for occult blood test is when you have a smear of your stool sample on a cardboard paper. It's then tested for the presence of blood. Colorectal cancers often bleed, so if the blood is present, you will usually need to have a colonoscopy to look for signs of cancer. Risk factors: a high-fat diet, predominantly from meat, physical inactivity, smoking, drinking alcohol, and diabetes. They recommend we eat like a hunter-gatherer, not a caveman. Cut back on red meat like steaks and burgers. Instead, fill up on more than 5 servings of fruits and vegetables a day. These changes alone can reduce your risk factors by about 50%. Get off the couch. American Cancer Society recommends 30 minutes of activity 5 days a week. Active men get less colorectal cancer. Quit smoking and limit your drinking. Keep alcohol to 1 or 2 drinks a day and stay at a healthy weight. Things to remember. Treatment for colorectal cancer can range from a colonoscopy, where the cancer that is contained in a polyp is removed with a snare-like instrument, to surgery or a colectomy, where a portion of the intestine that has cancer is removed, and if possible, the intestine is then reattached together again. If this is not possible, you will see the intestine being rerouted to a colostomy or ileostomy. If the cancer is spread in the body, treatment will usually involve chemotherapy. A final note in this: death from colorectal cancer is preventable, most often with early screening. Now let's discuss strokes. A stroke is the leading cause of functional impairment. 6 months after a stroke, 26% of those 65 and older are dependent on others for their activity of daily living, and 46% have cognitive deficits. A stroke occurs when an artery to the brain or in the brain either becomes occluded or blocked with a clot. There are 2 primary reasons this can occur. Plaque can build up from cholesterol, which can narrow the vessel impeding the flow to the blood to the brain. The other reason for strokes occurring is when the arteries begin to leak or rupture. This type of stroke is almost always a result of long-standing high blood pressure or uncontrolled high blood pressure. It causes the artery to balloon out and begin to leak, or at times totally rupture, which is an aneurysm. When either of these occurrences happen, the results can vary from mild symptoms to a devastating, life-altering loss of speech, loss of use of one or more of your extremities on the affected side, to death. Risk factors. The number 1 risk factor is hypertension and the control of hypertension. Being overweight and inactive, heavy or binge drinking, use of illicit drugs such as cocaine or methamphetamine. And the reason for that is they are vasoconstrictors, so they constrict the diameter of the arteries so that the blood flow is limited. Cigarette smoking or exposure to secondhand smoke, high cholesterol, diabetes, obstructive sleep apnea, which is a sleep disorder in which the oxygen level intermittently drops during the night, cardiovascular disease such as heart failure, heart defects, heart infection, or abnormal rhythms such as atrial fibrillation, and other risk factors associated with a higher risk of stroke include family history, being older than 55, race, African Americans have a higher risk than people of other races, gender, men are at a higher risk for stroke than women, and personal family history of previous stroke, TIAs or transient ischemic attack, which is a mini stroke, diabetes, and high cholesterol. Healthy lifestyles. For prevention, healthy lifestyles, dietary factors, and exercise reduce the risk of developing hypertension, which reduces your risk for strokes. Diet known as DASH, or a dietary approach to stop hypertension, emphasizes fruits, vegetables, nuts, limited saturated fats such as red meat, cheese, and butter, and limiting your sodium intake. People with hypertension should do routine screenings with the automated cuffs at home and target for a systolic blood pressure of 140 or less regardless of your age. Regular blood pressure screening with appropriate treatment of hypertension is important. Include lifestyle modification for patients, especially those that are pre-hypertensive. Maintain a BMI below 25, exercising, stopping smoking, or any use of tobacco, and screen for sleep apnea. Chronic obstructive pulmonary disease is emphysema, chronic bronchitis, and asthma. This is with chronic obstructive pulmonary disease, symptoms include breathing difficulty, cough, sputum production, and wheezing. It's caused by long-term exposure to irritating gases or particulate matter, most often from cigarette smoke. People with COPD are at an increased risk to develop heart disease, lung cancer, and a variety of other conditions. Risk factors are exposure to tobacco smoke, people with asthma who smoke, occupational exposure to dust and chemicals such as long-term exposures to chemical fumes, vapors, and dust in the workplace, age. COPD develops slowly over years, so most people are at least 35 to 40 when symptoms begin, and genetics. As noted above, the uncommon genetic disorder, alpha-1 antitrypsin deficiency, is a cause of some cases of COPD, and other genetic factors likely make certain smokers more susceptible to the disease. Prevention: don't smoke. If you smoke, quit. Avoid secondhand smoke. Avoid exposures to chemicals and fumes, and avoid exposure to dust. Now let's talk about diabetes. Diabetes is a disease in which blood glucose levels are above normal. Most of the food we eat is turned into glucose or sugar for our bodies to use for energy. The pancreas, which is an organ that lies near our stomach, makes a hormone called insulin to help regulate the glucose, to help get the glucose into our cells of our body. When you have diabetes, your body either doesn't make enough insulin or can't use its own insulin as well as it should. This causes the sugar to build up in your blood. Diabetes can cause serious health complications, including heart disease, blindness, kidney failure, lower extremity amputation, and diabetes is the seventh leading cause of death in the United States. The risk factors are weight, inactivity, family history, race, although it's unclear why people of certain races, including blacks, Hispanics, American Indians, and Asian Americans, are at higher risk. Age: your risk increases as you get older. High blood pressure: having a blood pressure over 140/90 often increases your risk of type 2 diabetes. And abnormal cholesterol and triglyceride levels. People with high levels of triglycerides have an increased risk of developing type 2 diabetes. Your doctor can let you know what your cholesterol and triglycerides levels are. Prevention. Eat healthy, get physical activity, and lose excess pounds. In a healthy diet, you want to choose foods that are lower in fat and calories, high in fiber, and focus on fruits, vegetables, and whole grains. You want to try and get 30 minutes of moderate physical activity a day. Take a brisk daily walk, ride your bike, swim laps. If you can't fit in a long workout, break it into smaller sessions and spread throughout the day. Lose excess pounds. If you're overweight, lose an even 7% of your body weight. For example, 14 pounds if you weigh 200 pounds can reduce the risk of diabetes. To keep your weight in a healthy range, focus on permanent changes to your eating and exercise habit. Motivate yourself by remembering the benefits of losing weight, such as a healthier heart, more energy, and improved self-esteem. Now an overview. Let's focus on, as you may have noticed, the prevention for many of these illnesses is very similar for the leading causes of death. In general, eating a healthy diet that is low in saturated and trans fats, 3 to 5 servings of fruit and vegetables, whole grain products will help with a number of health issues. Getting off the couch, become more active. When weather's permitting, get outside and go for a walk. It can also be enjoyable and good for your health. If you smoke, stop. If you don't smoke, please don't start. Talk to your primary care physician if you need help with quitting. These things are very important, as well as remembering to have your yearly screenings done. Get your blood pressure, cholesterol, and a fasting blood sugar done yearly, and as well as your yearly preventative screening exams, such as your PSA and your colonoscopy if it's recommended. Now, as I want to thank you all for taking time from your day to attend this month's webinar, I do want to remind all of you that My Pathway to Health has many different interactive tools and educational material for your use. Also, remember your health coach is available to help with you any health concerns or goals that you may have. We'd love to be a part of your success story, so please give us a call. And with that, I will end today's webinar and thank you all for attending.